In my presentation, I will be role-playing as a nurse teaching a patient about Lovenox using the rights of medication administration. I will be confirming the right patient, right reason, right drug, right route, and right dosage. It is important to assess the patient first to make sure that they are able to retain the information about to be taught and that they are mentally able to engage with the teaching. I will also educate my patient about important things to know associated with Lovenox, including what to expect and when to call the doctor in case of adverse effects. Hi, Mrs. Jones. My name's Sherry, and I'm a nurse here to teach you about your new medicine, Lovenox. Is now a good time?
Sure.
Okay, I'm just going to wash my hands and check your bracelet. Can you tell me your full name and date of birth?
Patsy Jones, January 9th, 1972.
Mrs. Jones, do you know why you are taking Lovenox injections?
I don't really know. While I've been in the hospital, everything has been changing.
I understand. Sometimes things can change rapidly when you're in the hospital. Do you want me to tell you a little bit about why you need to take this medicine?
That would be nice.
Okay, you had a DVT or a blood clot deep in your vein. This medication is used to make it to where your blood stays thin and you don't form blood clots, so they cause other issues.
Oh, okay.
Do you have any other questions for me about why you need to take this medication?
No, I will take this medicine to keep my blood clots from getting worse.
That's right, Mrs. Jones. Now it's important you know this medication works by thinning your blood, so you may experience some side effects. Common ones include nausea, vomiting, bruising easily, and pain at the injection site.
I can deal with those if they aren't extreme.
There are times where certain things happen that aren't normal, and you need to call your doctor right away. Abnormal bleeding, including nosebleeds that don't stop or coughing up blood, need to be brought to your provider's attention immediately.
I understand. I will call my doctor if I have any unusual bleeding.
Okay, Mrs. Jones, we're about to begin learning how to give yourself your Lovenox injection, but it's important I ask you a few questions first.
Sure, go ahead.
Are you allergic to any medicine or food?
I have no allergies.
Have you ever taken a blood thinner before?
Before I came to the hospital, I only took the occasional Tylenol or Aleve.
Okay, this medication is administered as an injection. Are you comfortable with the idea of giving yourself an injection?
Sure, needles don't bother me.
Okay, then we're ready to begin learning how to administer your Lovenox injection. The first thing you want to do is gather your supplies. You'll need a sink to wash your hands, an alcohol swab, a Band-Aid, your medication, and a sharps container.
I already have all of that stuff at home except a sharps container.
That's okay. The pharmacy can provide you with a sharps container when you pick up your medication. Now that we have our supplies, we can go to the sink and wash our hands. Now that our hands are washed, you can go ahead and check the medication label to make sure you have the correct medication. Your medication label should say Lovenox 40 milligrams per 0.4 milliliters. Is that correct?
Yes.
The other thing to check is the medication expiration date to make sure the medication is within date to be used. Can you find that on the label?
Is it this one?
Yes. If that were ever past date, you would not want to use the medication and instead call your pharmacy to see if they can issue a new syringe. Okay, Mrs. Jones, this medication is administered as a subcutaneous injection in the abdomen. Subcutaneous means we need to inject into the layer of tissue between the skin and the muscle. To do this, we're going to use a small, short needle attached to the end of your medication syringe. It's important to not uncap the needle until right before you're ready to inject. We will go through it once with the cap still on so you're familiar with the injection process, and then we will administer the medication together. How does that sound?
That sounds good.
In order to administer your medication, you'll need to pick an area on your abdomen. You want to stay 2 inches away from your belly button and avoid your waistline, where your pants would sit. Then we're going to take an alcohol swab and we're going to clean the area well. It's important to do this, that way we don't cause an infection. Once you've cleaned the skin, it's important to let the skin completely dry before you inject your medication. Then you're going to pinch the skin and inject into the skin using a dart-like motion at a 90-degree angle straight down. Once the needle is inserted, you will slowly press down the plunger to administer the medication. Once the medication is administered, you'll slowly pull the needle straight out at the same angle it was inserted. Once the needle is out, it's important to not recap the needle, to keep it pointed downward, and to dispose of it into the sharps container. Mrs. Jones, do you think you could reteach me how to administer this medication?
First, I need to gather my supplies, wash my hands, and check to make sure I have all the right medicine. Then I will check the expiration date. Then I will pick an area on my abdomen 2 inches away from my belly button, but avoiding my waistline where my pants sit. I will clean the area really well with an alcohol swab and then let it dry. Then I will pinch my skin and dart the needle in at a 90-degree angle and push the plunger slow to give myself the medicine. Then I will move the needle, not recap it, and place it in the sharps container.
That's right, Mrs. Jones. Good job. Now we're ready to do it for real. All right, well, since my daughter helped me do my presentation and I'm not going to show her belly on screen, I will just pull up the video and talk through the actual administration of the drug. So here we have the patient who is administering the Lovenox. She's choosing her injection site. She's making sure she's 2 inches away from the umbilicus. She's cleaning it with her alcohol swab. Getting rid of that alcohol swab, taking her Lovenox injection, uncapping it, discarding that cap straight into the sharps container. Then she's going to take that syringe. She's going to pinch up that skin. 1, 2, 3, using a dart-like motion. She's going to go straight down at a 90-degree angle. She is going to push that plunger to administer the medication. She's going to pull it out. And then she's going to take that syringe, and Lovenox has a nice security feature that you can pop out after it's been used, so you don't have to recap the needle, but you're not going to risk a restick, and then just toss that entire thing into the sharps container.